Mom, are you okay? What moms need to watch for when they get home. Mastitis. Mastitis is an inflammation in the breast tissue that sometimes involves infection. Symptoms can be breast swelling, breast warm to the touch, skin redness, pain, burning sensation, continuous or while feeding, feeling ill, fever of over 101 or greater. Call your doctor. Treatments can include antibiotics, pain medication such as Motrin or Tylenol. You can still breastfeed with mastitis. You want to keep your breast well drained so you don't get clogged milk ducts. Postpartum hemorrhage usually happens the day of delivery or one day after delivery, but it can happen up to 12 weeks postpartum. You need to call your doctor if you are soaking a pad in an hour, if you are passing a lot of blood clots or large clots the size of a plum, your bleeding is not decreasing each day, you feel weak or dizzy, you're having increasing pain at your perineum. Postpartum preeclampsia. Moms are watching during pregnancy for signs of preeclampsia. Moms need to know that postpartum preeclampsia can happen even 6 weeks after delivery. Please call your doctor if you're having high blood pressure greater than 140/90, severe headaches, changes in your vision, blurred or temporary loss of vision, pain under your ribs on the right side, decreased in urination. The baby blues. According to Dr. Sarah Allen, the baby blues affect 60 to 80% of all new mothers. It usually occurs within the first 3 days following birth and continues for a couple of weeks and goes away on its own. What causes the baby blues can be triggered by physical changes, emotional factors, or both. After birth, your hormone levels of estrogen and progesterone, which are very high during pregnancy, plummet. What do the baby blues feel like? You may feel worried, irritable, or nervous, especially about being a good mother. Feel sad and cry a lot over things that typically wouldn't bother you. Feel moody or cranky, have trouble sleeping, even when the baby is asleep, eating or making good decisions. What can help? Limit visitors, ask for help, get rest, get out of the house, avoid people that make you feel bad, and be with people that help you feel good. Postpartum depression. The CDC reports 15 to 20% of women, almost 1 million women in the U.S. each year, are affected by postpartum depression each year. Some of the symptoms: feeling that you cannot take care of yourself or your family, insomnia, intense irritability, overwhelming fatigue, lack of joy in your life, crying, difficulty motivating yourself, thoughts of harming yourself or your baby. It can happen to any of us, and it's not your fault. Tips to help: call your doctor as soon as possible, as you may need some short-term medication. Talk to a therapist that specializes in postpartum depression. Get rest. Ask for help. Don't wait. Do whatever you need to do to get help. Seek emergency help if you have any chest pain, obstructed breathing or shortness of breath, seizures, thoughts of hurting yourself or your baby. Call your doctor if you're bleeding or soaking through more than one pad in an hour, or blood clots the size of an egg or bigger, an incision that isn't healing, a red or swollen leg that's painful or warm to the touch, a temperature of 100.4 or higher, a headache that doesn't get better even after taking medication, or a really bad headache with vision changes.